Couple months back in August, we treated Joy's right hip, and she said we fixed it in one visit. I don't believe that, but you know, you'll get lucky every once in a while. But since we cleaned up her right hip that she was chronic for a long time, she started noticing more that she's feeling on the left. And when that happens, a lot of times what you're seeing is that the side that's hurting is usually the one that's doing more work. So a big thing that I always look at when I'm interpreting data was, is there trauma or not? That really helps me understand if I'm looking at a compensation or if I'm looking more of like a local problem. So if Joy would have been like, hey, I got sideswiped by a car and I got jammed in here and I fell in a hole, I think there. But a lot of times what happens with people is it's just compensating from where it is. So symptoms are important. They let us know there's a problem, but they don't tell us everything. Because if we go chasing symptoms, we're going to go down a rabbit hole that we don't want to go. So this test is what I call the hip functional test. And we're going to be basically seeing how the adductor is moving, the posterior capsule, and we're also going to see if there's some dysfunction in there and possibly the cartilage in the hip, in the labrum, or if there's some extra bone growth in there as well. So with this test, they're going to be lying on their back nice and easy, and Joy's going to drop her hands to the side. And what we're going to do is I'm going to be picking your leg up, and I'm going to bring it straight back towards your chest, okay? So we just let them kind of know what we're going to be doing. We're not interpreting any data. I just want to do a basic scan to see where that is first. So I'm going to be here, and I'm going to let the knee bend. And you want to make sure that you keep it straight up going at 90. Sometimes people will bring it out here and it can cheat that a little bit, or internally as well. So we're going to go here, and I want to see how easily her quads can come up and touch her ribs. And I'm also looking at that other hip, because that other hip will compensate as well. And hers starts to kind of kick up. So that tends to be my range from where I'm at. So if I didn't address for that other hip, see how she can get a lot more, and she gets that sway in there? So look for that on both sides as you go. So she's right about here, and I'm here. Now I want to get in there and take a picture or take a measurement. I like to use my fingers on this one, and I'll go in here, and she's about 5 fingers from touching on her quad to her ribs. A full test should be their quad should come up to the ribs, easily touch.
Are you looking mid-quad?
Yeah, basically like mid-quad to the bottom part of the ribs. In there, if they have a little extra on their stomach, it's okay. You still got to kind of go in there and feel that. It might alter that test a little bit. Each finger is about 10% dysfunction as we go in there. So right now her left hip is functioning right about 50%. Now I have my range, I have my data. Now I want to collect what she's feeling. So we're going to go symptom location, quality, and severity. So we're going to go here. And with Joy, sometimes you just got to, it's not ideal. Normally I would just be able to go in here like this, but since she's compensating for that, we're going to go in here. Where do you feel that pain?
The right lower back.
Right lower back. What does that pain feel like?
Sharp.
Is it mild, moderate, or severe?
Moderate.
Moderate? Good. So now we have one data point on there. Now we're going to look at the other hip as well. Same story. Here, here. And that one's really guarded. And this one just has like a hard feel and a hard stop, and it's actually pushing me back in there. So that test isn't even approaching 90. So that one's like a total failed test, and we don't even, it's hard to get a measurement on there as well. But what you'll feel is this one is actually more of a tissue component because we can push it a little bit. This one's like a hard feel. So what Joy actually has in there, and I know this because I've done a history on her, she's got some damage to the cartilage in there and the joint itself. So a lot of times there's this thing called like a cam or pincer lesion where the bone, extra bone grows in there in your hip, and it's just not designed to do this. This is very common in females, especially in like the 20, 30, 40-year-old range, because when they were younger, as they're growing, their body lays down more in there. So you get a lot of those clients that come in and say they get some deep pain in their hip flexor, and they think it's a hip flexor problem. This is actually a joint problem in there. So this one gets missed all the time. So people think it's a hip flexor problem. It's not, it's something deeper in the joint. So that one's not moving as well either. That's got more of like a hard type of feel in there. So we get that data on there. There's still some work we can do to go in there and clean it up, but it's just not going to be optimal. And I'm surprised she did as well over these last couple months from there, cleaning it up, but we'll go in there next and we'll go into the treatment side of that as well. Adductor magnus, really important muscle, vastly misunderstood. It is huge. It takes up a huge cross section of the thigh. It is so important in hip function, hip stability, everything like that. The job of the adductor magnus is kind of to drive your leg through space. So I see this a lot in my runners, my athletes, especially like cyclists, triathlon people, or people that sit on their ass all day. That can cause some problems in there too. So What I find with the adductor is that people actually aren't on it. They're either too far forward on the muscle called the gracilis, or they're too far back on the muscle of the hamstring. So the key is actually getting in there and finding that. And that's where you get those landmarks and you get that palpation in there. So when I palpate this one, what I like to do is have it right up against here on my bottom part of my hip. And then, can I roll this up just a little bit? And this is one where you just explain to the client what you're doing. Like this muscle kind of lives through here and goes up there. Now, I don't tend to find a lot of dysfunction further down or higher up where it's tendinous. I tend to find it in the muscle belly itself, because that's usually where you're going to lay down more scar tissue. You're not going to get as much scar tissue in the tendon. You're going to get more of degeneration in the tendon. So you don't have to worry about as much as like going up higher in the groin. And a lot of times why people are feeling pain higher up in the groin is because they're stuck through here, so that tendon's pulling higher. So don't always listen to the client about where they feel it. Go in there and feel it for yourself. So I like to palpate this under just a little bit of tension, and you can have that foot resting on the table. Now what I like to do is kind of find my landmarks. So Joy's a little jumpy. So this over here is gracilis, and back here is hamstring. So when you hit gracilis, it's very superficial. It hits me right there. When I hit hamstring, it's very superficial as well. Now, it kind of separates out just like that. And now what you can see is how deep I'm able to go in on there. And when I palpate it, I like to palpate it with a backed up thumb as I go in there and palpate, because we want to go straight 90 degrees into the muscle. So what I'm going to do is I'm just going to go in there and just get that depth, and I'm just feeling. And we practiced this with our quad earlier, and see how it translates over to here. And right there is where she's really starting to get jammed up. So you can see over here how I can sink in just a little bit more. Here I sink and it just stops. So that is where I'm finding that dysfunction. That's where that scar tissue is. So for this area, very sensitive for people, use some lotion. Not a ton of lotion, not like when we were working the quad, more lotion in that area, because we want to feel it. It's going to be tender in there as well, especially people that just have some sensitive skin in there. So a little bit of lotion in there. And then my motion is going to be having it right here on my hip. And what you're going to see is I'm going to kind of step back into like what I call like a fencer stance. And then I'm able to get some more tension where I lean back and almost face that other way. That's going to be the motion to kind of get that hip going. And that's like the ideal motion for where we want to go. So we'll try to do that. And sometimes if it doesn't work, I do have to just use one hand and go from there. But I want to try to do the ideal one first. So we're here. And I started right about a shortened position with a little bit of tension to start. Lotion's in here. I already found it. And what we're going to do is my depth is going to be straight in with a body lean. See how I go in with just dropping my sternum down? My tension is going to be leaning into it just like that. Now that's loaded up, and I'm going nice and slow, and this is going to be tender. And I'm just getting back in through here, and I'm really leaning, and I'm just doing slide over top of that. What kind of slide is this, Charles? Internal, because it's coming to me, right? And I'm going nice and slow. I'm not in a hurry. Now, I want you guys to practice with two hands, but Joy's is just pretty jammed up. So I'm going to get there. I'm going to get it with one hand now. So this is where and it's not ideal, because remember, we never want to have our thumb out in space unless we absolutely have to. So now what I'll do is I'll go in here, sink in, back out a little bit, tension. And it's going to be tender, and you go nice and slow. And I'm just leaning. Now see how I can lean away with my body? I can get better motion with it, but I can't get as much tension. So you got to sacrifice one thing for the other. I'm going to do one more. And just keep checking in with them. Are you okay? Yep, she's fine.
Still breathing.
Still breathing. It's just one of those areas you got to get it, you know, like, and that's why you say, that's why the treatments are quick. But the stuff that's really jammed up is going to be jammed up, so it's not going to feel great. So if the client's flopping off the table, be like, do you want to get better or not? You know, suck it up. And unfortunately, you tend to see more men than women complain. And this is coming from a man, and this is why men Can't have babies because then we wouldn't have any population left anymore.
And that's the lesson of the day.
Yes. And see how all the things we learned about depth and tension plays in. It's a Karate Kid, wax on, wax off. Back out. Here. And then you see that range is improving. And I only did 3 on it, but I was really, really slow. You okay? And normally when I treat a really intense area in a really intense muscle, I'll have the client just kind of take a walk around. Let it kind of settle down. You don't have to, but normally I'll have them take a walk around because she'll tell you this is very intense but very focused. And then every time after we treat it, we want to do a retest and see where we're at. Here, drop your arms for me. Here, remember, hold back behind here. A little better range. What are you feeling there? Yeah, before I was getting hit here, now it's coming up a little bit more. So what's in there now is there's a little bit on the back part of that capsule. But what I like to do, especially if it's the first treatment, is I really only clean up that adductor and get into that habit of like being okay stopping. You know, instead of being like, oh, I want to do a little bit more, I'd rather have on the first visit or two, do less. It's like give them that medication. I want to give enough to be effective, but I can actually do too much as well. So I want to go real slow and understand you get the client 5 to 7% better per visit. We're 7, 8 visits in, we're 40, 50% better. So go slow as you go in there.